going to tell you all you need to know about the cost of dental implants and specifically all-on-4. Hi guys, thanks for tuning in. I'm Alex Fibishenko. I'm one of the implant surgeons at All-on-4 Clinic. My practice is exclusive to dental implants and dentofacial surgery, and I work with numerous dentists and specialists in offering what is often life-changing treatment for dental cripples and denture wearers. Over the next few episodes, I'm going to tell you all you need to know about the cost of dental implants and specifically All-on-4. How we do it differently at our clinic using more advanced, immediate final teeth system, which we call All-on-4 Plus, without paying a premium. Dental implants treatments are not cheap, especially when you need a full mouth reconstruction. The cost can vary between different methods, but so do the risks and the results. So I'm going to try and explain the differences, as well as the cost and the kinds of rebates and special payment schemes that are available. The question of cost varies depending on individual circumstances. One review site compared 839 doctors and clinics worldwide and found that the average cost of All-on-4 was just over $30,000. At All-on-4 Clinic, we do these procedures almost daily. And as a general guide, our typical fee is $25,000 per arch, either top or bottom. And this is for All-on-4 Plus, which includes the immediate final teeth and some other important things, which I will cover later. There are some situations where the bone quality or the volume is so poor that we need to use some additional procedures, like nerve transposition, bone grafting, or special long implants anchored into the cheekbones, known as Zygoma implants, which can all be done at the same time and in the one surgery, but can add $3,000 to $9,000 to the cost. These situations are not common, and by far, most treatments end up being around the $25,000 mark per arch, or $50,000 of doing top and bottom together. The cost includes all the preoperative planning and procedures such as photos and digital impressions of your mouth, digital smile design where we do digital modeling of the planned positions of the new teeth, the surgery itself, which is performed by experienced and specially trained implant surgeons, and it includes a template of teeth that mimics the digital design, which can be tried in the mouth immediately after surgery on the same day to allow us to just fine-tune the appearance of the smile and the bite. Often patients can go home with these teeth so that they're not without teeth. The cost includes all the laboratory procedures and customization, and of course the immediate final teeth, which is a hybrid of the finest acrylic teeth on a custom-milled titanium frame. The cost also includes the 3-week review and hygiene appointment, the 4-month review and x-rays to check the healing of the implants, and all repairs and minor adjustments as required for 2 years. All-on-4 Plus procedure can be done under local anesthetic at no additional cost. In most cases though, it is preferable to do this under general anesthetic. There is an additional cost for this, but there is a substantial rebate from Medicare for the fees of the specialist anesthetist. Unfortunately, Medicare does not pay for any of the dental implants fees. For those with dental insurance, this treatment falls under major dental, and there is an annual limit typically within the vicinity of $1,000 to $2,000, which is not much, but something. There are also options with early release of super for patients who are in pain from their teeth. This has become a very popular option for those who have enough in their super and who are eligible, as it allows you to draw out of your super for health reasons. Our treatment coordinators can give you more information about that. To understand the costs, you need to understand what's involved and what are the various options. There are many steps and many costly components and costly technologies that need to be used in the planning and throughout the treatment, which makes it expensive. Also, the implants that we use are amongst the most expensive in the world, because of the research and technology that has gone into them. But we don't charge a premium when we use them. Having facilities that can produce immediate final teeth with a milled titanium frame is a sophisticated and expensive setup. But again, we don't charge a premium for that. Lastly, the kinds of surgeons, staff and technicians who are involved in the whole process have to be experts in the area of implants and have undergone a great deal of education and training, which makes their time more costly, but also more valuable and efficient, and the results more predictable. The alternative older methods of a staged approach and temporary teeth typically involve simply gluing a prefabricated denture to the implant posts. As you can imagine, the fitting surfaces of these temporary teeth are quite often rough, trapping food and making them difficult to keep clean, which can result in inflammation and excessive shrinkage of the gums. Temporary teeth are also fragile and can crack or break during the healing process, which can put the healing implants under undue stress, resulting in bone loss or failure. You would think that the older temporary teeth method should be the cheaper alternative, especially because it's quicker and requires a much less sophisticated process. But I have seen it being the same or even more expensive at some clinics that advertise All-on-4 widely. More importantly, the patient's experience is very different. They have to endure 3 to 4 months of wearing temporary teeth and then undergo another process to make the final teeth, as opposed to walking out with a great smile using All-on-4 Plus and our unique immediate final teeth system. I know that this treatment will not be affordable to many, but if it is within the realms of possibility, the results that I have seen have been life-changing. And quite often, patients' only regret is not doing it sooner.
No regrets at all. I wish I was able to do it sooner.
I should have done this many years ago.
At our licensed clinics throughout Australia, there are a number of finance options. Some are completely interest-free, which makes it more affordable. The question of whether it's worth it is an individual one and depends on the issues and limitations that you're experiencing with your teeth. How can you put a price on your health and quality of life? Being able to bite into an apple, chewing all kinds of food without pain from crumbly teeth, smiling with absolute confidence and being proud of your smile. Often people who have had infections from the teeth say that they feel healthier, have more energy, their skin even feels healthier from getting rid of all their teeth infections.
I feel like my old self, like I used to be. I feel like I'm revived and fresh. So I want to get out there and start living again, because I think that was really bringing me down, the way I looked with no teeth and problems I had eating.
People who had dentures before this treatment can suddenly feel the roof of their mouth and can bite into an apple. They don't need to worry about their dentures falling out when they sneeze. These are the aims of this treatment, and if done correctly, and Mother Nature agrees, these are also the results. Stay tuned for episode 2, where I look at the cheaper as well as the more costly alternatives to All-on-4 Plus with some real-life examples. For more information, check out our website and YouTube channel and join one of our online seminars. Otherwise, you can just email us for a consultation or to request a free copy of our All-on-4 Plus book. Thanks for tuning in. See you next time.